अस्सलामुअलैकुम नाज़रीन। पाकिस्तान में बच्चों को अच्छी नशोनुमा ना मिलने की वजह से पाकिस्तान के बहुत से बच्चे बीमारियों का शिकार होते हैं। बच्चों की अच्छी नशोनुमा, साफ़ खुराक और सेहतमंद ज़िंदगी के लिए हुकूमती इक़दामात जारी हैं। आइए जानते हैं कि डायरेक्टर जनरल मिनिस्ट्री ऑफ हेल्थ नदीम जान ने पाकिस्तानी बच्चों की सेहतमंद ज़िंदगी के लिए क्या इक़दामात उठाए।
Exporting it to the other countries. There is a huge market of FMS in the globe, and we would like to tap that. So we are moving very fast on that, and the partners are coming in the last week of this month. They will be joining us in the venture, and I already had talked to the leadership of Bill Gates Foundation, your leadership, of course, Nutrition International. From us, we are with you and others also. With the Canadian partners, we appreciate the Canadian government for their support in nutrition. I've been informed of it, but we would like it to be scaled up. So they also would pool some resources into this initiative, because with one entity we would not move forward. So the funding would come from a pool of resources. Bill Gates Foundation, Canadian government, Nutrition International, and these private charities like Junaid Foundation and the Kirk Foundation. So they will then assemble and sit together and then guide us how best and how fast we can take this forward. So that's on the supply side. Linked with this is the awareness phase also. There is this energy available in each and every program, and we need to be very opportunistic about that. We've got huge interventions, family planning, polio, EPI, nutrition, and many other things happening at the ground level. So we need to take that opportunity. Just this morning, I tasked my team that I want a comprehensive integrated BCC. So a BCC specific for one domain would not lead us anywhere. We will still be moving in circles as we have been moving since centuries. So this is not acceptable. We want one BCC, so the nutrition, family planning, polio, EPI, they should sit together. And then they guide us for one BCC strategy in the country which is encompassing and which meet our needs. Nutrition, child health, maternal health, EPI, family planning, all this. And there is enormous amount of potential available in our resources. We need not to go for extra funding and extra resources, extra human resource. We just need to tap that opportunity. It's a point of advocacy, planning and coordination, which the Nutrition Task Force, which I have announced today, they will steer that. So that's another take, and I would like this, Masood, you and your team lead on this. So we come out with an integrated BCC. All programs that are working in Pakistan, they have their community outreach. We need that community outreach to also amplify and communicate our nutrition messages. Very simple messages: kitchen gardening, breastfeeding, complementary feeding, adolescent feeding, MMS, nutrition. So these are very simple things. We need to go forward. So the problem is lack of coordination and lack of, it's not a political will, I think it's a societal will, and it's a developmental will that we need to augment and we need to galvanize. And how we can lead it? The onus is on this chair that I'm holding. So from my side, you will see, and you have seen, the commitment towards nutrition. I had my first interaction with the nutrition people on breastfeeding in the same hotel, I think. So it will continue, but we want concrete results. We want a paradigm shift in our policies, programs, implementation, and community outreach, because we are in a hurry. We are not in a hurry because of our domain, but we are in a hurry because we already lag behind. We missed MDGs and we will miss SDGs grossly. So this need to change, and in this change, it's not only government's responsibility. Each and every entity and every stakeholder engaged in these operations and these programs and these interventions, they're equally responsible. So that accountability will also, we would like the transparency in the mechanism and the operations, and also a degree of accountability also to everyone. To us, first, hold us responsible. Of course, we are leading it, we are the owner, but we will also hold responsible our partners for the lapses and for the lack of impact that they had created. So I would like this to be galvanized, and a momentum is...
And Mr. Lucas Van Argon, Secretary Developments from the Canadian High Commission, my worthy colleagues from provincial departments of health and education from across all the 3 provinces. We're lacking the team from Sindh. However, it is a great pleasure for me and an opportunity to thank you all for taking out time and joining us in this dissemination of a pilot project which we feel, sir, was a success because it led to upscaling. While the minister was speaking, I could see that this was coming from the depth of his heart and from the vast experience as a public health person that he is. A champion of health and nutrition in the public health sector. Dr. Nadeem Jan is a motivating person for all of us, and we are so glad that at this moment we are being spearheaded by a person whose heart is in what he was saying. Myself have also been in this arena for the last 3 to 4 decades. And being a mother myself and seeing how we have not been making much progress in spite of so many projects, programs, investments, it does lead us to reflect. And the minister has put it very rightly. We need to come together. That is something which is missing. So we look forward to making an impact, I say even making a dent and others building on it. A step in the right direction like this VIFA pilot project, where a lot of effort was gone into planning it and demonstrating it as a model and learning and upscaling. Our neighboring countries have similar programs at the national level. Anemia being a prominent micronutrient deficiency, and you know that it impacts the mothers, the future mothers, these adolescent girls. So a national program for young girls on giving them preventative irons weekly is not going to cost us much. It is a doable program, but it has a lot of health implication for the future generation. So I'm going to stop here and thank each and everybody, especially my media colleague, who I see is a huge lot of them have come and will take the message from this forum today to much wider audiences across the country on awareness raising. The media has a critical role to play. And it's a good thing that now we have the social media and people, young people especially, visiting social medias and learning. But holding accountability, our own selves and the government, it was so good to hear these words, because until we make efforts towards transparency, monitoring and accountability, I think we will not be able to achieve impacts. So these kind of critical words sound very good to the ears, and we hope that over the coming years, as a nation, we'll be able to contribute to the mothers, future mothers, the children of this country, and that we improve our indicators. I'm so grateful to the minister for announcing a separate task force in nutrition, much needed, because as we know from our indicators, so many surveys shows very little improvement in nutrition. In fact, it has deteriorated. So heads put together, 1 + 1 is 11, and many minds put together on how to make a strategy which is doable and implementable and impactful. Donors and partners have always played a catalytic role. It is the government which takes the ownership, and I say, like the minister, where there's a will, there's a way. We can do it together. Thank you.